Hello everyone, and welcome back to Health Diagnosis. Today, we're talking about the very common yet often ignored problem, a nail fungal infection, also known as onychomycosis. Many people suffer from it silently, thinking it's just a cosmetic issue, but the truth is if left untreated, it can become painful, stubborn, and even spread to other nails or skin. So, in this episode, we're going to understand what nail fungus really is, what causes it, how to recognize it early, and the most effective treatments and prevention methods available today. Let's start with something simple. What exactly is nail fungus? Nail fungus is a type of infection caused by microscopic fungi that thrive in warm, moist environments. These fungi feed on keratin, which is the protein that makes up our nails and skin. When they invade the nail bed, they start to multiply, causing the nail to change color, thicken, and sometimes even crumble. Now, you might be wondering, how do these fungi get under your nails in the first place? Well, there are several ways. They can enter through small cracks in your nails or cuts in the surrounding skin. Walking barefoot in public places like swimming pools, locker rooms, or communal showers increases your risk. Wearing tight shoes that trap moisture, not drying your feet properly, or having sweaty feet also create the perfect breeding ground for fungus. And did you know that people with diabetes, weak immune systems, or poor circulation are more prone to these infections? Even aging itself increases the risk because our nails grow slower and thicken with time, making it easier for fungi to settle in. Let's talk about symptoms. A healthy nail is clear, smooth, and pinkish. When fungus invades, the nail begins to change color, often turning yellow, brown, or even white. It may become thicker, brittle, or distorted in shape. Sometimes, you might notice debris building up under the nail or a slightly bad odor. In advanced cases, the nail can separate from the nail bed, causing discomfort or even pain when you wear shoes. Now, here's an important point. Not every discolored nail is a fungal infection. Sometimes, similar symptoms can occur due to psoriasis, eczema, or even injury. That's why it's important not to self-diagnose. If you suspect a fungal infection, consult a dermatologist or healthcare professional. They might take a small sample from your nail and send it to a lab to confirm the type of fungus. Once the exact cause is known, the right treatment can be started. So, how do we treat nail fungus effectively? There are several approaches, depending on how severe the infection is. For mild cases, topical treatments like antifungal creams, gels, or medicated nail lacquers can help. These contain ingredients such as cyclopirox, amyral fine, or fluconazole. However, topical treatments work best when the infection hasn't deeply penetrated the nail bed. You need to apply them consistently for several months, because nails grow slowly. In more advanced cases, oral antifungal medicines may be prescribed. The most common ones are terbinafine and itraconazole. These medications travel through your bloodstream and reach the nail from the inside, helping new, healthy nail growth replace the infected part. Usually, treatment can take several weeks or even months, and it's very important to complete the full course. Stopping too early can cause the infection to return. In some stubborn or severe infections, your doctor may suggest other options, like laser therapy, which uses focused light to destroy fungal cells, or in rare cases, surgical removal of the affected nail to allow a new one to grow. It might sound intense, but these methods can be effective when standard treatments fail. Of course, alongside medical treatment, you can also take simple steps at home to support healing. Trim your nails regularly and keep them clean and dry. Avoid nail polish during treatment. It can trap moisture and slow down recovery. Wear breathable shoes and moisture-wicking socks, and never share nail clippers, towels, or footwear with anyone. Fungal spores spread easily from person to person. Now, let's talk about natural or home remedies. Some people find relief using natural antifungal ingredients like tea tree oil, vinegar soaks, or Vicks VapoRub. While these may have mild antifungal properties, they're not as effective as medical treatments for moderate or severe infections. They can, however, be used as supportive care to prevent recurrence or keep mild infections from spreading further. Always consult your doctor before using any home remedies, especially if you have sensitive skin or other health conditions. Prevention is always better than cure, right? So here are a few important prevention tips. Keep your feet clean and dry. Wash them daily and dry thoroughly between your toes. Change your socks at least once a day, especially after sweating or exercise. Choose shoes that fit well and allow air circulation. Disinfect your nail tools regularly and never use unsterilized instruments during pedicures or manicures. If you go to a salon, make sure they follow proper hygiene practices. And remember, always wear slippers in public showers or pool areas. You might also want to strengthen your immune system through a healthy diet. Include foods rich in vitamins and minerals like biotin, zinc, and vitamin E, which promote nail health. Probiotics found in yogurt, kefir, and fermented foods. They can also help maintain a healthy balance of good bacteria, supporting your body's natural defenses. Now, one common question many people have is, can nail fungus come back after treatment? The answer is yes, it can. Even after successful treatment, fungal spores can linger in shoes or socks and cause reinfection. That's why maintenance is key. Disinfect your footwear, change socks frequently, and continue good foot hygiene even after your nails look healthy again. You can also use antifungal powders or sprays to keep your shoes dry and clean. For people with diabetes, extra care is needed. Check your feet regularly for any color changes, cracks, or wounds, and get professional care at the first sign of infection. A small fungal infection can lead to bigger complications if ignored. If you wear artificial nails or use nail polish frequently, give your nails a break now and then. Fungus thrives in dark, moist conditions, so letting your nails breathe can make a big difference. Another myth we need to clear up is that nail fungus only affects toenails. While toenails are more commonly affected because of sweaty shoes and moisture, fingernails can also get infected, especially in people who frequently wash dishes, work in wet environments, or wear gloves for long hours. One last important message: don't feel embarrassed if you have a nail fungal infection. It's far more common than you think, and millions of people experience it at some point in their lives. The key is to treat it early, stay consistent with your care routine, and follow prevention tips to avoid recurrence. Ignoring it will only make it worse, so take action today. If you found this information helpful, make sure to like this video and share it with friends or family who might be dealing with the same problem. And don't forget to subscribe to Health Diagnosis for more valuable health awareness videos every week. Your health matters, and the more we understand our bodies, the better we can care for them. Thank you for watching Health Diagnosis. Stay healthy, stay aware, and take good care of yourself and your nails. See you in the next video.